Hi, my name is Regina Young. I'm the Trauma Outreach and Injury Prevention Coordinator here at Erlanger Trauma Services, and I'm here with my good friend Kathy from NAMI Chattanooga. NAMI connects folks with mental health resources, and the reason that's important for trauma patients is frequently we see patients that come in that have multiple diagnoses. Not only are they hurting physically, but they're hurting mentally as well. Kathy, I'll let you introduce yourself.
Hi, I am Kathy Milam, and I am the president of NAMI Chattanooga. And NAMI stands for the National Alliance on Mental Illness.
So Kathy, tell our viewers a little bit about what services NAMI offers here.
Okay, I would be glad to. We are one of 600 affiliates across the country that serve the local people, and we help with support groups, we have education, and we advocate for our loved ones at the state level and at the local level. And we have evidence-based programs. One of our best is called Family to Family, and it is an 8-session class that addresses the brain. We have videos on the brain. We talk about medications. We talk about empathy and communication with our loved ones. And one of the major goals that we teach in this class that it is not your fault. It's for anyone who has a loved one. It doesn't have to be just a parent. It can be a friend, a partner, anyone who has a mental disorder. So we teach understanding and empathy, communication, and we also get into some problem solving. And it's a great place where people meet and understand that they are not alone. That is one of our favorite things, is you are not alone, because mental illness is a disease that's not easy to talk about with other people. We call it the no casserole disease, because with other diseases, people come to your house, they bring you food, they talk to you, they encourage you. With mental illness, people don't understand. There's so much stigma that they tend to stay away. So our people, and even especially in a support group, they can come and freely talk about what's going on, and we share our experiences and how do you get help and how do you deal with specific things with your loved one.
And I understand now, of course, with COVID, we're not able to meet in person, but your support groups are online, so they're easily accessible.
Right, they are all Zoom. We made that switch to Zoom like the rest of the world, and it's great because many people who couldn't actually walk into a support group physically can now just get on the computer, and it's a lot easier. So all our formats are still in the Zoom, and it's working. It's what we have to do, and we are still reaching people.
That's excellent. So if I came in to that Zoom support group and I needed access to certain resources, can you help me with that?
We can help. Now, NAMI as an organization cannot recommend professional people, or we cannot recommend medications. What I can tell you is what helped my daughter, and how I got the services I needed, and where to go, and if you have to call mobile crisis, how is that done? Because in that group, probably somebody has had every experience you can imagine with trying to get their loved one help.
Excellent. And then lastly, I know that you advocate on behalf of those with mental illness and their caregivers, both locally and at the state level. Can you tell us a little bit about that as well?
Yeah, sure. That's really fun and really exciting. And before COVID, we would go to Nashville, and there's certain days, and we would make appointments with our legislators, and NAMI will actually train you how to speak to your legislator. And NAMI Tennessee has the bills that they are working on and what they feel is important, and they will prompt you how to talk to your legislator in a easy way, and it's so much fun to be at that level. So.
And are they doing that virtually now? I know some of the other organizations have
We were not able to do that virtually. This year, what NAMI did was have a whole series of very informative Zooms on advocacy,
Okay,
because we were not able to get into the State House and
okay.
talk.
All right. Well, thank you so much for coming today. This has been very informative, and I hope that it will help our trauma families and their loved ones to have some support here in the community.
Thank you for having us.